kaibahan ng Philippine Mental Health Law is that kung mapapansin nyo sa first few pages niya, sobrang heavy niya sa mga rights. And the rights are actually very comprehensive. No? So nandiyan yung rights of the service users, so freedom from stigma and discrimination, access to care, freedom from solitary confinement and torture, nandiyan yung access to services, and information about mental health services. I-highlight ko lang din siguro dito yung right to confidentiality. So as much as possible, no, we have to provide for privacy and confidentiality nung patient na yan. And of course, I know you're very much familiar dito sa mga ganito. Pero of course, there are exceptions also to confidentiality. So nandito yung mga following exceptions. So disclosure by law or court order, nandiyan yung express consent ng person, pag merong life-threatening emergencies such as suicide ideations or self-harm or pag nakaka-harm na siya ng ibang tao through violence. So definitely those are exceptions to the rule. And of course, if the service user is a minor and the victim is suspected to be abused. So yung mga ganito, pwede nang i-break yung confidentiality. And I think this is my favorite, nasabi ko nga kanina, yung participation of service users in mental health advocacy planning, legislation, and service provision. So if you're going to talk about paano siya i-cascade sa or paano siya i-implement sa law school level, siguro we have to map out sino ba yung mga possibly mental health service users na willing na mag-share ng kanilang stories and perspectives dun sa pag-craft ng mga policies. Because I think napaka-importante ng input nila in terms of mapping out ano ba yung mga appropriate interventions na pwedeng gawin. So we have to put agency sa kanila to actually implement those kinds of or to design those kinds of programs. And of course, nandito rin yung mga legal rights. No? I know you're very much familiar with informed consent. So basically, this is informing patients of the possible benefit, the possible risks, the possible options, and including the right to withdraw ng consent at any point in the intervention. Meron rin tayong safeguards, no, to promote, to protect human rights. Nandiyan yung pagkakaroon ng advanced directives. So ito yung pagkakaroon ng document that actually outlines ano ba yung mga preferred at hindi preferred na services ng isang person just in case that they lose the capacity to decide for themselves. But take note, kung titignan nyo yung mga international instruments, like for example, the one advocated for WHO, yung Special Rights Initiative, no? Yung mga international human rights instruments that are promulgated by the World Health Organization, they would say that every person, kahit na meron siyang mental condition, retains the right to be to have choices sa kanyang mode of care. Pero dito sa advanced directive, merong ganong option pa rin for them. And of course, nandoon yung the right to have legal representation as well as designate 3 supporters, no? So hindi ko alam kung anong wisdom kung bakit 3 supporters, pero yung supporters na yan can be informed of the situation nung na pinagdadaan ng patient, ano yung treatment that na in-undergo niya para makatulong siya doon sa decision making nung patient, no? And of course later on I'll be talking about more on the internal review board. Ayan. And of course yung rights rin ng mga family members and health providers are also covered. So basically ano lang dito to summarize, nandito yung participation nila in terms of formulating and implementing the treatment plan of a person, of course subject to the permission nung service user. And for the health providers naman, yung nila basic labor rights, no, yung protection from precarious work, as well as advocating for the needs of the service user, as well as participation dun sa planning ng how the health facility is actually designed and structured. So for the legal community, probably you might need to understand these different rights para at least pag merong lumapit sa yung service user, no, matutulungan din natin sila in terms of providing some form of support. I understand na hindi pa kayo pwede magbigay ng legal advice, pero you can actually guide them kung saan sila pwedeng, kung ano yung mga available legal supports that they can actually take advantage of. And engaging with some of the service users, marami silang talagang mga legal issues. And sometimes it's not just related to violation of the rights na nakasaad dito sa RA 11036, but also violations on their pwedeng violence against them, no? Pwedeng discrimination sa labor. So kailangan holistic din yung pananaw natin, and we have to also provide them with those kinds of information. In terms of health governance, merong binuong Philippine Council for Mental Health, which serves as the policy-making, planning, coordinating, and advisory body to the Department of Health. So right now, nabuo na ito 2 years ago pa. And nandiyan rin yung pagtatatag ng separate mental health division under the Disease Prevention and Control Bureau of the Department of Health. So dati kasi ano lang siya, small office lang siya, pero ngayon separate division na siya. So this is the composition of the Philippine Council for Mental Health. So as you can see, para siyang IATF, no? Para siyang Interagency Task Force. But the good thing here is that it includes civil society organizations, no? So nandito yung representative from academe or research, nandito yung representative from medical or health allied organizations, and one representative from non-government organizations. So sila yung parang nagbabalance dun sa conversation inside the Philippine Council for Mental Health. And right now, of course, lahat ng mga different agencies are actually tasked to localize ano ba yung mga different steps that they need to make na para integrate yung mental health perspective in their line of work. And one of the pinaka-start talaga for me is the work of the Commission on Human Rights. And siguro dito rin papasok yung other legal entities na kung pwedeng i-review rin natin, no? Ano ba yung mga guidelines that they release with regard to voluntary confinement, the use of restraints, and consent. So, alam ko naman na evolving pa rin yung mga discussions with regard to this one. And I'm not sure kung gaano kalakas or gaano karami na yung jurisprudence natin when we talk about mental health in the legal side of things. So, probably we might need to also incorporate that wisdom sa mga guidelines that health professionals are already developing right now. And in terms of service delivery naman, so very important that we highlight that quality mental health services are very much needed. So they have to be grounded on medical and scientific research. And of course, it has to also be responsive to gender, culture, and ethnic, no? And special needs of individuals na ma-identify natin from different sectors. And of course, it has to be, number one, age appropriate. Pangalawa, it has to be least restrictive. Ibig sabihin, hindi natin kinukulong agad ang mga patients sa mental health facilities, no? So, of course, I don't want to add to the stigma pala. So, I wouldn't say na kinukulong, but more of confinement sa mga mental health institutions. Okay. And of course, yun nga, since holistic rin yung pananaw natin in terms of services, we also need to build up, I think for me, yung services natin both from psychiatry, psychology, as well as neurological services. And of course, yung mental health promotion dito should also be attuned doon sa specific needs ng mga iba't ibang mga sector. And we're very lucky kasi nakasama kami doon sa pag-draft ng law na to when we were still discussing it. Nalagay natin yung mga suicide prevention and response strategies with particular attention to the needs of the youth sector. Kasi if you would look at it, most of the mental health problems do stem up from experiences when we were younger. So important na ma-take into consideration yan. And of course, na-highlight natin kanina yung shift to community-based services. So we need to integrate mental health services sa mga services na binibigay na natin sa mga barangay. So it has to be, kumbaga, kung paano natin dineliver yung pagbabakuna o kaya yung pagbibigay ng maternal care. So dapat yung mental health services should also be available. So this includes training, no, and coordinating with the local government units in terms of prioritizing as well as coordinating with the private sector para sa mga mental health services. And very specific rin yung pagtugon sa suicide. Actually, this September, we're actually celebrating Suicide Prevention Month. And right now, we actually have a hotline by the National Center for Mental Health to address suicide cases. So, ayan. So, mandated rin actually to develop a national framework in terms of addressing suicide. Actually, just yesterday, we were in a meeting with the DOH and we're actually trying to develop that program already. Especially now na posibleng mas mataas yung mga mental health concerns ng mga kabataan. Ayan. So, it's also important that we implement mental health policies and programs in schools, no? Pero additional lang din dito is that merong age-appropriate integration into the school curriculum. So ngayon yung DepEd is actually starting this and some of the professions have already started incorporating mental health. So paunti-unti, for example, sa pharmacy profession, nag-integrate na sila ng mental health as examples sa mga cases nila. So maraming mga models that we can actually explore with regard to this one. And for the health professionals, to augment the supply in terms of health human resource, psychiatry and neurology are already required subjects in all medical and health allied courses. So ano pa rin to, developing pa rin ito. I'm not really seeing a lot of kumbaga progress with regard to this one, pero nandoon yung direction. And of course, yung implication naman sa legal community, we have to develop mental health programs and policies in law schools, no? And of course, para sa mga law students that might be diagnosed already with mental health problems, then we might need to talk about how to provide reasonable accommodations. And I know in some schools, wala kayong mga guidance counselors. So probably we might need to also lobby for human resource to address the specific concerns of law schools and law students. And of course, nandiyan rin yung pagkakaroon ng mental health lens in delivery of legal education. Siyempre, hindi naman I submit na maraming mga debates with regard to this one. Kasi siyempre, parang sometimes hindi natin alam kung ano yung impact ng pedagogy natin sa mga students natin. So we might need to have those kinds of conversations. And in workplaces, of course, nandiyan yung pag-raise ng awareness, correcting the stigma and discrimination, and providing support. Kasi unlike in schools, wala tayong mga guidance counselors in workplaces. So it's important that we also train people sa mga ganong area. So probably we also need to have proactive mental health support para sa mga clients, no? Especially pag kunwari, naging lawyer na kayo, syempre yung mga clients ninyo, hindi lang legal battle yung kinakaharap. Sometimes they might also have psychological needs. So we might actually need to address and promote proactive mental health support for them, as well as lawyers, no? Syempre as lawyers, medyo mabigat rin talaga yung expectation and demands from you. So probably we might also need to think about as a similar program for caring for the carers, pero for law students. And even for the professors, kasi nga possibly na yung professors rin might also be experiencing some form of mental health concerns. Now, there's also a specific provision in the law regarding the people who use drugs. So again, very stark na contrast dun sa War on Drugs framework, na titignan natin na yung mental health concern or substance abuse is a mental health condition in itself. So dito, sabi niya sa batas na drug screening services are actually to be included in local health facilities. Now, if they've been found positive for using drugs, then we might need to also screen for mental health conditions kasi pwede rin silang nagko-contribute sa paggamit ng illegal substances. So we might need to look at ano ba yung mga algorithms kayo ng Department of Health and how much can we actually save, no, doon sa pagkakakulong by providing mental health interventions muna before going to very punitive interventions. And of course, nandiyan yung public awareness, having a national multimedia campaign kasi nga walang policy or program na bebenta kung hindi naintindihan ng mga tao na meron talagang need for mental health services. And of course, nandoon pa rin yung need to address stigma and discrimination. Now, this might be interesting for you as law students. Sa mga as part of health regulation, nandito yung pag-ensure ng mga implementation ng human rights frameworks in mental health facilities. So, merong sineset up na internal review boards in every hospital, pero I think it's not very practical also. Comment ko na lang din yun. Pero each hospital raw should have a specific representative from DOH, from CHR, and a person nominated by an organization representing service users and families accredited by the Philippine Council for Mental Health. So, yung mga tatlong tao na to will actually review, no, and institute mga mitigation strategies regarding doon sa mga human rights violations or oversteps na nakita natin in facilities. And ito yung mga functions nila, hindi ko na iisa-isahin, pero yun nga, monitoring, review, audit of cases, inspection of mental health facilities, looking at disputes and controversies, and identifying steps kung paano ma-address yung mga violations na yon. So probably as legal community, wala pa kasi ako nakita na parang specific group looking at mental health violations na specific. So you might be interested, no? And siguro, I know that we have clinical legal education and some of the schools are actually mandated to have office of for legislative legal assistance, no? So parang yung mga legal aid clinics natin. So probably they might be potent kumbaga forces to actually help dito sa mga internal review boards natin. So I'm not prescribing any specific na strategy, pero something to explore sa legal community. And of course, merong penalty, no? So ito yung mga specific violations in the law. Failure to secure informed consent, violation of confidentiality, discrimination, as well as administering inhumane, cruel, degrading, or even harmful treatment not grounded on scientific evidence. So pwedeng magkaroon ng jail time as well as fines with regard to this one, or both. No? And in terms of health financing, initially kinuha siya sa DOH appropriations. Pero right now, there's a special shout out to PhilHealth para magkaroon ng mental health benefit packages for people with mental health conditions. Kasi right now, yung kina-cover pa lang nila is yung acute inpatient care. So malaking problem 'yon, no? Especially na hindi naman lahat ay kailangan ng long-term facility. So probably we might need to also cover yung mga consultations and other mental health concern na neurological or psychological in nature. And of course, yung health information system should be shaped para at least magkaroon tayo ng very good data. So alam niyo naman, di ba, kahit sa COVID, kailangan natin ng granular and scientific data para at least alam rin natin how to act. And the National Center for Mental Health is actually assigned to actually head the research institute for mental health concerns. And siguro, dito na rin papasok yung legal research, no? Kasi ngayon may binubuong mental health research agenda. So probably we also need to look at ano ba yung mga researches that we can do in terms of mental health, no? Sa legal research side naman. So sa mga naghahanap ng mga thesis diyan, so call me, beep me, mag-usap tayo on possible research topic. Ayan. So in terms of health human resource, of course, nandoon yung need for augmenting health human resource through capacity building, reorientation, and conducting trainings. Now, those are the provisions in the law na very compact na siya. Pero of course, we all know that there's a big gap talaga between policy as well as implementation. That's why I'd really like to get the support sana of the legal community to continue advocating for mental health. At malaking bagay that we're having these kinds of conversations because civil society really needs to do its part to make sure that the law will actually realize what it actually promises. And I think sana ma-apply yon sa lahat ng mga magagandang batas na meron tayo ngayon. So maraming salamat po sa mga law students, and here are my contact details. So if you want to reach out, have some more conversations, I'm very much open to have those. Maraming salamat po.
Thank you, Dr. Lagi. Thank you very much po. So, sobrang insightful, no? Sobrang dami kong natutunan. Sobrang dami po namin natutunan sa lahat. And I think it's really important that he made mention that policies like this already exist. So, I think in order for our schools to implement it more, we need to make our voices heard. So, we need to really speak out about our situation. We need to speak out about the things that we need for our schools, for our workplaces, para din alam nila kung saan ba, ano bang gusto nating mangyari in the future in terms of our mental health and the legal education in the legal community. So maraming salamat po, Doc RJ, for that very, very insightful discussion about the Philippine mental health law. So this morning, just to recap, we talked about stigma and the challenges of law students in terms of mental health. So we acknowledge, and we all know that there is really this struggle for law students, that we have to face this. Aside from our law studies, aside from our work, aside from our families and friends, we have our personal struggles, and we acknowledge that. And then next, we talked about how help is here. Help is here. There is a law in place. There are people lobbying in different parts of the country, in our own schools. The Legal Education Board is with us. They're crafting policies, and then help is really here to really, implement kung ano ba yung mga dapat na nating gawin na para mas ma-overcome natin itong battle with our mental health issues. And at this point, we will talk about our particular situation now. So with that in mind, realizing that we have a problem, and then realizing that we also have help in place. We have also the professionals around us that will help us. Let's talk about how this pandemic and how the online learning situation is affecting all of us and how we can cope. So just a reminder, singit ko lang po, if you guys have any questions, feel free to click the Q&A and then introduce yourselves, and then let us know kung ano po yung gusto nyong ma-discuss natin later in the panel discussion. And I really would like to thank the people who are chatting us and then making the chat box alive. Maraming salamat po for your presence. Thank you for sharing us with your experience, and then affirming that this is actually a really good program by the LEB and the ALSP. So to continue with our discussion, share ko lang, I recently saw this post about how different it really is in the setup natin with online learning and dealing with the pandemic. I saw this post na hindi lang physically tiring hindi lang physically tiring yung mental health. Hindi lang physically tiring yung situation natin ngayon na online learning and then yung pandemic, 'di ba? It's also very emotionally and mentally tiring. I remember, share ko lang my experience. I remember during the first run of our midterm examinations, yun na yung time ng pandemic. So wala nang choice. The midterms had to push through. And all my life studying, I made it a coping mechanism na after I take the exams, I take a long walk. And then I see my friends. I talk to my friends. Syempre, hindi ako yung tipong I compare my answers kasi ako talaga ng ganun. Parang ano lang, yung breather mo na, uy, saan tayo kakain? Ganun. And then, the pandemic came and then the midterms came. Tapos nawala lahat yun. It's so hard. It's so hard not having to talk to your friends, not having to have that parang paano ba? To have that support na, uy, ako din nahirapan, uy, ako din nangangalay na ako, uy, ako din sobrang sakit na ng braso ko. Sobrang hirap. And then wala tayong choice and we have to push, we have to continue, we have to fight. Kailangan higa ka na lang kasi the next day you have another exam, and then iyak na lang, ganun. But then we have to move on, we have to continue, we have to fight. And I think the next speaker will be sharing some of the things that yung makakatulong sa ating law students to cope with the online learning situation that we have right now and the pandemic, and then how to overcome all of it. So our next speaker for this morning is a psychometrician, a psychologist, and a guidance counselor practicing at the Far Eastern University. She is the founder of the Peer Organization of the Philippines, and she is here to talk about building resilience in the time of pandemic. So please help me welcome Dr. Sheila Marie G. Hoxon. Good morning, Doc.
Good morning. Okay.
Good morning po.
So magandang umaga ho sa inyong lahat, to all the organizers, Legal Education Board, and Association of Law School of the Philippines. Of course, I would like to also acknowledge Commissioner Catherine Pedrosa, J.M. Suelo also for inviting me over. Pat, of course, to Russell, who is also the one who invited me also for this morning. And of course, to dear Mama Rose, the guidance counselor of La Salle Law School, okay, who also invited me over. So it is with absolute honor and pleasure to be here and being with all the heads, no, and all the law students, okay, of the Philippines. So are you ready for this exciting topic? So Pat, later baka lang magtawag ako ng recitation. But this is not exactly attacking, no? So I would ask
Kakabahan po yung mga yan, Doc.
So we will just have a little
sharing
about what we are doing. So what I'm going to do is not really a lecture, but it is more on a sharing on some little practices, no, coming from evidence-based practice of cognitive therapy and of course positive psychology. So you can call me Sheikh Hoxon, and I'm encouraging everyone to participate with our activity through the chat box, okay? Para po hindi tayo makatulog. And my agreement for you this morning is that I hope that you focus on your strengths. I do hope that you focus on your family, your loved ones, your classmates, your friends' strengths, and of course your school, your teachers. Hindi natin sila kaaway. Sila ay ating lakas. Okay? I do hope that we also focus on the strength of our school, our organization, our community, and of course, our country. And I do hope that we nourish our strengths, and I do hope that we are grateful for our strengths. So kaya ba natin yan? Okay. So our situation now is that this is what they call the age of disruption, where we are all pushed, no, from the traditional learning, traditional life that we have, the face-to-face. Now we are now already into virtual meetings and even virtual classes. No? I can remember when I was a guidance counselor of University of Santo Tomas. No? So sa mga pre-law classes pa lang, no? mga estudyante namin, meron minsan na ihi, no? Because of takot, especially first year, like legma, political science students, no? Okay? And lalo na pagdating sa law school na talaga minsan, pag hindi talaga prepared, no? Okay? And it's a VUCA world, no? Okay? And this is what they call, when you talk about VUCA, it's what they call V. Okay? V stands for volatility. Everything was so fast. No? U is for uncertain. We are not sure when it will be finished. Hanggang kailan tong online classes na to, itong pandemic. C is for complex. No? What happened to us was really on the physical first wave. The second wave was now, marami naghihirap talaga na Pilipino. And of course, even abroad. And of course, A, hindi puti. No? And we are thankful for all the organizers, no, for this morning to give you the vision as a law student. Eh? Kailangan talaga natin ng compass at direction. And I'm really alluding all the organizers for putting this great activity, especially for the law students. And if we have vision, vision na nagagaling sa ating gobyerno, sa ating eskwelahan, sa ating batas, no, na diniscuss kanina ni Dr. RJ, I do hope that we also have the better understanding. Okay? And if we have the understanding, malinaw, malalaman natin, no, ano ang clarity ng purpose at vision natin, bakit tayo dito sa law school. Okay? So ito sa ating pamilya, kundi para sa ating bayan. Okay? And of course, for us to also go for definitely our nation building. And of course, A is for agility. So sa pagiging fragile ng ating pag-iisip, no, ng ating puso at ng ating galaw, and even values are being shattered, especially in these times of anxiety and worries, it is very important that we go for learning agility. Okay? So yung tinatawag na as you become a professional in the future, it is very important that you go for what? Professional humility. Okay? So ito rin yung bilis, no, sa pagresponde. This is definitely being what you call strategic, going for action and reinvention. Okay? Kasi kung hindi, maiiwan talaga tayo pag hindi tayo nakasabay. And yan ang ayoko mangyari sa inyo, na maiwan kayo. Okay? So always remember that our environment in social psychology, okay, that the kind of environment that we have influence the type of behavior of the people. So kung ano yung mga kinagagalawan natin ngayon, pag negative ang nababasa natin, negative ang bahay natin, negative ang mundo natin, of course, what is that? It can be our family, it can be our school, our environment, our technology. No? Pag negative din ang ating technology, of course, the globalization that we have, napakabilis po ng mga best practices na naiimbento ngayon. Of course, the pandemic prior, it is what we call the negative experience. And as a law school, syempre, napakahirap po pag-aaral natin. It affects our thought, no? Na nagiging ating isip, na nagiging ating puso, ng ating galaw, ng ating attitude, which is also composed of psychological well-being. Paano po natin malalaman na maganda ang ating pag-uugali at maganda, no, ang psychological well-being natin? It is all coming from the growing mindset. Kaya dapat, as a law student, matatag ang pag-iisip mo. Okay? So okay lang naman minsan maging negative, no? Pero hindi dapat talaga pwede yung sobrang toxic positivity rin naman. Okay? There's a caveat regarding that. So if you have a growing mindset, no, yung na-down ka, pero kaya mong mag-bounce back, it will happen. Of course, you have a growing belief okay, a growing feeling, growing behavior, and values, and definitely you will be successful. So, critical understanding, okay, well-being in the general sense. No? So that if you want to really bounce back, kailangan din. No? Syempre, minsan there are times na talagang ang tulog nyo ay 5 hours lang. But it is very important that we have to remember na ang ating pagtulog ideally 8 hours. So time and stress management is very important. Of course, healthy cognition. Later, I'm going to discuss some cognitive behavior, simple techniques. No? Of course, emotions, how to handle emotion like self-regulation, online and offline. Okay? Pag tayo ay medyo negative ang ating sinasabi, and of course, how we behave in technology are somewhat puro negative then, we can create a lot of emotional contagion. Of course, family, social health, if we anchor ourselves as supreme being, and if we don't, of course, I do respect. Okay? One also of the chunks of well-being is also what you call somewhat a spiritual anchor, okay? And that's what we call holistic well-being. So in the Harvard well-being framework, these are the factors, okay? Physical, of course, our career development. Ito ba talagang law na ito ay para sa akin? Okay? Are we having some career indecisions? Okay? Relational, positive connections, okay? Emotional, okay? Intellectual, environmental, okay? But in this digital, okay, in the study of Nina Hersher et al., in the flourishing, now, if you want to flourish in the digital age, and we are more on prevention, as psychologist and counselor, I go more for prevention. Okay? So maganda itong webinar na ito. That somewhat, as we go along in our classes, okay, I do hope that we flourish, we prevent mental health problems. That's why what? We really have to focus on our strengths. Okay? So yung weakness natin, pwede naman yan, pero data na lang yan, history na lang yan. No? Lessons for us to improve more and flourish and thrive, okay, in our digital law school. Okay? So, important na aside from physical health, mental and relationship, okay, well-being, and if we want to be productive and we want to be successful, it is very important yung tinatawag na digital citizenship. Okay? So, may mga na-interview ako na law students na okay, na talagang mas mahirap daw ngayon ang pag-aaral, no? Kasi mas maraming babasahin in the digital online learning. Okay? So it is very important that aside from the digital foundation that you are tech literate, no? You know how to secure yourself, okay, online and offline. It is very important, no, yung digital engagement and digital wellness. Okay? So I'm going to give you a little somewhat question later. Okay? So ano po ba dito sa model ni Hersher ang pinaka-importante sa inyo? And somewhat that provide you the strength in your family, in your law school, and for some who are working. Okay? And in order for us to flourish in the mental health spectrum, ang average po natin is moderate mental health. But if we want to really flourish, no, and prevent mental health disorder, no, para hindi po tayo magupo ng mental health problems, it is very important that we go for flourishing. Okay? And yan po yung ingredient para mag-flourish tayo. And also to enhance the student well-being. Okay? So my question now is, what is the most important aspect of your wellness in order for you to be resilient and flourish in this digital age? Sige. Tingnan natin anong nagbibigay sa inyo ng lakas? Okay? For some of my participants, no, in the evidence-based research, those are more into spirituality and family. Okay? So tingnan nga natin sa chat, okay? Kung ano, pwede ba silang mag-chat or open lang yung Q&A?
Hi, Doc. Ano po? Nagchat po sila.
Okay,
mga
sorry.
answers na
Ayan.
ayos po. Doc, sorry, excuse lang po. Medyo naririnig po namin yung fan nyo.
Ay, sorry.
Naririnig lang po namin.
Oh, sorry.
Okay lang po.
Yeah, sorry. Mainit
So,
kasi
again,
ngayon,
guys,
no?
the question is, what is the most important aspect of your wellness in order to be resilient and flourish in this digital age? So some of the comments po, Doc, family, relationship, physical health, family and support group, spiritual relationship, ayun po, ang dami po, ang dami,
Yan,
family,
dami. Nakakatuwa,
relations,
no?
family support,
Pero
yes po.
maganda rin yung tinatawag kanina, no? Something, talaga is dream, no? Your aspiration, no? Can definitely be your number one motivation for you to be resilient, no? It can be a dream. It can also be the dream of your family. Okay? Yeah, very good. Meaningful relationship is also very important. Okay? Yeah, God, family, and loved ones can definitely be your number one resource as well. Okay? So maraming salamat po. Okay? So pag medyo nahihirapan kayo sa inyong law school, it is very important that what? That you come back, no? Okay? Pakita mo ba ulit yung slideshow, yung sharing ko? Nakikita yung slide ko?
Yes po, Doc.
Okay, thank
Yes
you,
po.
dear.
Yes po.
So thank you so much. Okay? So it is very important that one of the anchors of this webinar is what we call the cognitive behavior. Okay? So the root of all problems can be your cognition. And this is coming from the theory of Dr. Aaron Beck, who is a well-known psychiatrist of University of Pennsylvania. And this is the basic that we are using. And ang president po ngayon yan is ang kanyang anak, si Judith Beck. Okay? And he's 99 years old and he's very sharp. And we are very fortunate to have the training of that evidence-based research in Pennsylvania. Okay, so we went there for a training, of course, with all the officers of the Philippine Guidance and Counseling Association. And we also brought it in UP, wherein we trained 500 counselors and psychologists to advocate for this evidence-based. Kasi ang sinasabi nga ng batas is, importante that what we talk, what we share with the people is not just Google. It is really more on evidence-based technique. Okay? And we are also very fortunate to go to University of Pennsylvania for the positive psychology, which I'm also advocating. And according to research of the University of Pennsylvania, this is one of the evidence-based training program that they have, wherein resilience program, okay, like what I will be imparting, some of that will be here, okay, will definitely decrease symptoms of depression and anxiety, and can increase a lot of well-being. Okay? So pag resilient din daw tayo, anong mangyayari? Yung mga addictions daw natin, no, hindi tataas, no, kundi pwedeng maiwasan at bumaba. Hindi rin tayo magiging pasaway, no? Okay? And I do hope that in order for us to really be leaders, importante talaga yung pag-iisip na tama, okay? Of course, yung pusong pagtatama, no? Okay? And of course, no, decrease in hopelessness, and of course, increase in the holistic aspect, especially about psychological capital. Na pag bumabagsak tayo, laging kumakapit na hindi to forever. Optimism, always being positive, no? Amidst the experiences that we are experiencing. So this is what they call anchored with a positive psychology, strengths-based, no? So hanapin natin para hindi tayo magupo ng pandemic. It is very important that you go for your personal qualities. Okay? Ano yung mga lakas mo? Maganda ka ba? Okay? Guwapo ka ba? Okay? Ano ang magaling sa'yo? No? Doon ka tumutok sa talents mo, sa abilities mo. And of course, yun nga, isa sa mga resources are what you call your aspirations and your interests. Okay? So it is very important that aside from individual strengths, i-match natin yan ng mga resources. So nakita natin kanina, nakaramihan talaga, even Filipino law students are really under resources. So yan yung ating Diyos, no? Okay? Yan yung ating pamilya. Okay? Our classmates, which are our social networks, no? Our organizations and the many opportunities. And if you combine all of the strengths, magkakaroon tayo ng superpower, no? And we can definitely be great and have a better quality of life. One of that is our education, our daily living, no? Social network, overall health, recreation, sexuality, and even our spirituality. And we can have better personal accomplishments, and we can also have recovery of power, especially na inubos ng pandemic. And of course, we will have social integration. And sabi dito is that this strengths-based program can also affect our attitude. Yung dignity natin, yung worth natin, mas makikita natin yung mga potentials natin. Our capacities, our rights, and even our quirks, like our indifferences and our similarities. At hindi tayo magkakaroon ng stigma. It was also used by Kevin Powell, a strengths-based approach as intervention for at-risk youth. Of course, also for child protection, even for schools, and of course, even for the industry. Okay? So we have to what? You always have to be friendly, but backed up by our professional ethics and firm discipline. And we also have to have a fair agreement. Okay? Na pag malaki ang problema, malaki ang consequence. Pag maliit ang problema, maliit din ang consequence. Okay? So this is coming from Turnell. Okay? So what is the advantage of focusing on our strengths? Okay? Especially the strength of the mind. So we build our strengths and resources. This is longer, long po ang impact nito compared to the problem focus. May pandemic na nakafocus pa tayo sa problema. Okay? Hindi po maganda. Okay? It is a double pandemic. It provides primary prevention rather than intervention. Okay? It also involves proactivity, proactive planning. It will definitely sustain our strengths, mas tatatag tayo. And of course, it also targets different cohorts of risk, and of course, strengths of population. So this is under the study of Leadbeater et al., cited also by the American Psychological Association. So what is the first thing that comes to your mind when you talk about strength? So what is that word or symbol? So because of lack of time, nakita naman natin ang lakas natin ay ang ating pamilya, ang ating pangarap, ang ating mission na makatulong, lalo na sa mga naaapi. Psychology, according to Sigal 2020, that strengths are built-in capacities. At ang inyong lakas ay hindi lang ang inyong mga abilities and talents. These are rooted from your healthy thoughts, healthy feelings, and healthy behavior and values. And ito yung magbibigay sa atin, pag matatag ang ating pag-iisip, this will definitely give us a lot of energy. Lalo na kung nega yung nasa harap mo, or nega yung mga nangyayari. It will definitely give you the capacity to endure like a superhero, to resist temptations, to withstand great force or pressure, and to do the things that need a lot of physical or mental effort. So ito yung magbibigay sa'yo ng focus kahit napakagulo ng pandemic. So these are also the strong positive attributes or assets. So strengths in various forms, actually nandun yan sa kamay ninyo, na nagbumula sa inyong pag-iisip. So ngayong mga panahon na to in the pandemic, marami talaga na-heal or somewhat na-prevent a mental health problem because of interest. And one of my interests is what they call the building, the peer organization of the Philippines. Ito po yung mga peer na tumutulong sa kanilang kapwa, kanilang kapwa youth, or even maybe you can also make some peer groups in the law school. Kasi hindi naman lahat pumupunta sa psikolohista. Kailangan nila ng kaibigan. Later, baby. Humingi ng pera yung anak. Okay. So what are your skills? Your skills can be also your strength. It can be your photography. This is somewhat a little posing to my husband. And my strength is also my advocacy. So ano bang advocacy nyo? Katulad kanina sa batas ng Mental Health Act 2018. Maybe magbukas sa inyo ito ng oportunidad to go for your passion for mental health advocacy. And what are your resources? So my resource is definitely God. Of course, this is my little family and my service to the community. And of course, always remember that in times of test, your loved ones is definitely the best. And is coming from your character strengths. Ito yung love, ito yung gratitude, ito yung becoming humble. So, nakikita yung character strength na yan. Nakikita rin yan unang-una sa character strength ng pag-iisip. So this is what we call the formula for strength in order for us to be resilient. that there's what they call a little formula, talent, which is a natural way na nasa atin yan of thinking, feeling, and behaving. Okay? And mamaya po, we'll have a little exercise on how to really process our thinking and multiply it by investment. Okay? Your purpose, your focus, your effort to practice, develop, and build your knowledge. So if you multiply it, your talent, with a lot of investments, and you will have what they call strength, makakayanan nyo ang law school. Sa una talaga mahirap. But as you go along, it's very important na yung experience ninyo and yung matatag yung pag-iisip. No? And of course, yung tiyaga, yun talaga yung magbibigay sa inyo ng resilience to really constantly provide near perfect performance. Okay? And ngayong mga panahon na ito, it is very important that you also focus on your unrealized strengths by scheduling kung ano pa yung mga gusto nyo gawin, no? Which can definitely be an advantage and a tactic for you to really thrive in the law school. Kasi training ground niya yan. Okay? And one of the strengths that you also have to really flourish, no, is what we call the digital foundation. Protect your personal information and data. Digital wellness. No? Kailangan talaga i-manage po natin yung ating digital screen engagements.